أهلا وسهلا. متواجد مع دكتورة أنيتا. دكتورة أنيتا, can you tell us something about the stroke cases, like, you know, how you treat the stroke cases? The stroke probably not less than a year old stroke cases. Now we have a lot of queries about the cases, about the patients who have been suffering from the stroke, paralyzed at home, one side paralyzed, you know, they call it shalal nusfi. So we have in what you have in Ayurveda when it comes to stroke.
Stroke is one of the major disability where we can say it is very difficult to manage even for the person as well as the family members.
Yes.
So Ayurveda has been treating stroke for a very long duration. It's called pakshagata, that is paralysis. And one side of the body is paralyzed, either, as you said, left side or the right side, depending on which side of the brain is being affected. So what do we do in Ayurveda is, first we analyze which type of stroke. Again, stroke can happen two ways. Generally 99% of the stroke people will have high BP. So their BP would have shooted up to 200 plus, where the blood vessels get broken, and then they have the hemorrhagic stroke, or they have a block, just like how people get heart attack, they get brain stroke.
Yes.
So two of the things, again, depending on what type, major is the block, and we do the treatment. Again, depending on the strength of the patient, we take a wheelchair patient, wheelchair bound patient, we take people who are unable to walk directly from ICU, and miraculously within 3 to 5 days they are able to walk.
Wow.
So the whole idea of making this is strengthening their muscles, because immediately once they become wheelchair bound or they are in the bed, then the muscle gets weak,
strains,
and then they are not able to walk, they are not able to put the strength. So simultaneously we do the treatment, Ayurveda, exercise, physio together, and along with the diet changes what we need to do, maintaining their blood pressure. So as I say, we take critical cases also. We start with first a treatment which is to the brain. So the first idea is starts with the brain, which is the causative factor why they have got the stroke. So a treatment called Shirodhara, where they pour the warm oil over the forehead, a medicated warm oil. If the patient is still weak, unable to take, we use the same medicated oil, apply it on the scalp, and we do the treatments. And within 3 days, the treatment with that, and we put a medicine to the nose, 2 drops. And
sorry to interrupt you, doctor. Is there a particular medication for the stroke patients, like in a particular medication for the joint patients?
Yes, there is definitely a good question. We have a very particularly medicine for the stroke, especially if I am doing Shirodhara, I will use Dhanvantaram or Kshiravalla, a particular oil which is required for the stroke. Again, if it is hemorrhagic, I use a different oil to the nose, or I use Shadbindu Taila Nasyam, which within 3 days will give them strength to walk.
Wow.
So as soon as that is done, then we give them massages. Depending on the strength, I give them steaming, which could be a very simple steam or towel steam or a medicated steam. And once it's been done, and then we give them healthy soups, sometimes even the nourishing soups which give them strength to the muscle. Sometimes we give them vegan protein powders to gain the strength, and with all these and some exercises, and as much as we make them write, so that their handwriting is improving every day. They have the strength to hold the pen and do
Is it a part of treatment?
Part of the treatment.
Okay.
So it's a holistic treatment where external treatment, internal treatment, food, writing, exercise, ball exercise, walking, and all these, including exposure to sunlight in the morning, everything is included in the treatment. That's how people can recover so fast. Within a week's time, they are able to walk. So people should understand the brain stroke, even if they have got once and then they have recovered, why Ayurveda treatment is important. It can re-attack within 5 years. So as per the statistics, 65% of the patients will get a second attack within the 5 years. So that's when the Panchakarma treatment of Ayurveda is important. So last time also I have been telling you, this is more like cleaning your system or gut, or it's like just like servicing your car. So we are going to remove all the toxicity.
So you mean to say by taking the Ayurveda treatment when it comes to stroke, the chances of recurrent
Re-attack.
re-attack is very less.
Yes, extremely less.
Okay.
So this over a period of time gives them strength. It's not just that you have to walk today, that you can do it with physical exercise or anything. You will start walking, but you have to make sure that this will not come back again. Just like heart attack, people who had heart attack, they have to go for repeat test, or maybe in 10 years they have to change the stent, they may get re-attacks. Similar way, those who have a stroke, there is always a chance of getting. So the whole idea of Ayurveda is removing the root cause.
Okay.
That's in the brain, and we need to remove that. We have to make sure the calcification doesn't happen, the arteries doesn't get blocked again.
Okay.
So certain medications, certain therapies are exclusively formed for this.
Okay.
And that is why the success rates are very high with the stroke treatment. And once it's been done, we also guide the patient how to manage at home, how to do exercises, when they have to repeat the test, or when they have to go. So this is a long-term management, will help them not to get the attack. So we have people who never walked from last 1 year, and after coming here they roamed around this beautiful property, and they could do the exercise, they could enjoy the nature. So that's how we do the treatments.
Okay. Last but not the least, what is the duration for the stroke patients?
Stroke patients, again, I would prefer 2 to 3 weeks minimum duration. Some stay even up to 1 month also. So depending on how much is the intensity
how
of old is the stroke case. If it is very new, then within 2 weeks we can do the changes. If it's little older, maybe 3 to 4 weeks is what we need for the stroke case.
Very nice. Thank you so much, doctor. We will know more about your treatments.